All right, so we are here with Christa. You want to
Hi, I'm Christa.
And so let's see, Christa, you had this is your second visit to us, right?
Yes.
Because we did your occipital surgery.
Yes.
How long ago?
5 months ago.
5 months ago.
Yeah.
Okay, and you've had not the easiest go of it, which is why we want to make this video so everybody sees that there are a couple different ways this can go. But so we'll skip to the end. It ends good. But why don't you tell me about how things were after the surgery and subsequent to that?
Yeah, for sure. It was definitely a bumpy recovery for about the first 4 months post-op. I actually had some of the old pain that I've had for almost 15 years, plus some new pain. So it was a little, I don't know the right word. It was just perplexing and
Unnerving. Yeah, not to be, yeah, there you go.
And yet, right around the 4 month mark, some massive changes started to happen and they're lasting. And so something really encouraging too is that even with the consistent old triggers, it didn't make the back worse, i.e. dental appointments, barometric pressure changes, things like that. So that was super encouraging.
And your particular case is worse than many. So just talk about what was life like before you had the first surgery.
Yeah, so basically in 2007, I was in a rollover car accident off a cliff and quite a lot of head trauma from that accident. And then a year later, another rollover car accident avoiding an elk on the highway. And that also had some impact to the head.
And I'm going to interrupt a little bit because we don't have elk here in Santa Barbara.
Oh.
I don't want, so
Okay.
Where are you from?
We're from Canada,
Yeah,
yes. I know,
okay.
if it was a moose, that would be even better.
that's true, but
yeah,
okay,
and then
so
around the same time, I was
north.
bit by a tick and was infected with Lyme disease and a sister to malaria. So it was sort of a perfect storm with a lot of adjutants potentially to the nerves, right? And then with the Lyme came seizures, and I would often fall and hit my head quite hard, back, side, front, all over. And so it's been 15 years almost of, trying everything. We've tried even our Canadian system said I exhausted the Canadian conventional system, tried lots of natural things as well. Nothing offered more relief than, honestly, hours or at most a couple days. And so it's been a long journey.
And you were spending a lot of time in bed.
Mm-hmm.
And
yeah, we've been blessed with 3 little boys, but often I'm not able to tuck them into bed. I can't participate in family gatherings sometimes, and even meals. Just the day-to-day enjoyment of life isn't always possible to participate in that. It's heartbreaking. It doesn't get easier, actually. It gets harder. But it's been amazing the last while that the back has been so much better that I find I'm even able to get out of bed a little sooner in the mornings, and like I said, the old triggers are not causing the aggravation that they were. So my baseline head pain for almost 15 years has been between a 4 and 7 over the whole head.
Mm-hmm.
And then slight triggers like smelling perfume or cigarette smoke or whatever, lighting, barometric pressure, flying in an airplane, all those things would send it skyrocketing to an 8 or 9 out of 10. And that's where I couldn't push through anymore. So right now, the front is at about a 6 or 7 right now that I'm just pushing through.
Mm-hmm.
But I look forward to when that goes down too.
And so what's the back now?
Like a 2.
Yeah. Okay.
If that.
That's great.
Yeah.
So, and just from a surgeon standpoint, I always love it when right after the case, people don't have any pain anymore, and it's all wonderful.
Yeah.
But we always talk about how this can take 3 to sometimes 6 months for things to equilibrate and get better, and it is as hard. No, it's probably not as hard for me as it is for you, but it is very, very hard for me as well. Just to those phone calls that we did for follow-up, where you can't comb your hair, you can't touch the back, the pillow, all of those things, and that was, it was hard for me to listen to as well. But we kept on saying the same thing. We know this can happen, and it can sometimes take up to 6 months, and it just that follow-up call that we had at 4 months, where you're like, yes, can go to church and I can
Yes.
do stuff again.
Sing
And I was
and
just,
laugh and talk.
I mean, it was wonderful. So, but we knew going in that you had some issues with the nerves in the front
Sure.
as well
Yeah.
as the occipital nerve. So
Yeah.
first round, we took care of the occipital nerves.
Yeah,
and-
because that one never ever let up, whereas
Yeah.
the front can sometimes ebb and flow a little more.
Yeah.
So I'm still thankful we did the back
Good.
first.
Okay.
And I'm just so grateful for your compassion, like that you were always very efficient and realistic and practical, but also compassionate. And I think that's I've seen more doctors than I can count over the last 15 years, and I really appreciate that from you. There's the
Oh, thanks.
professionalism, but also compassion, and I think that's a real blessing. So I'm grateful to God for you.
Well, I'm grateful that you're here and grateful that I've got such great patients. So
Round
it's,
two,
it's
let's
good.
do it.
So
I'm ready.
we're gonna go and
And
do
I
some
just have to
injections.
introduce my
And
man.
yeah,
I
this
think everyone watching understands the value of real support, and this man's been with me from the very beginning.
He's been fantastic.
Yeah, he's the real deal.
It's just this. And again, from a doctor standpoint, it's what you really hope for in somebody. A support system is super important, and
Yeah, it's not easy.
you're very lucky to have.
I think
such
they
good
suffer
ones.
almost more sometimes, right?
So next time, bring your kids. Hopefully, sadly, I'd like to see you another time, but
Yes.
that may be just to visit because
Yes, we'll meet at a park with our kids.
our last operation. So we're gonna do our nerve blocks today,
Yeah.
and then we're scheduled for surgery in 2 days to
Yeah.
to do the front.
Yeah.
But we wanted to get this video in because I'm not gonna pull you back down from Canada through a canceled flight in San Francisco and all of this kind of stuff just to do another video later to say how the front went. So, all right. Well, thanks very much for your time and
God bless and
telling
don't
me.
give up.
Yeah.
Those who are watching. I
There
was
you
you
go.
at one point watching Dr. Lowenstein's videos, and I'm so glad I did.
Oh, that's awesome.
Yeah.
All right, great.